Good morning, everyone. So after schooling and careers, we're going to be talking about aging. I'm going to talk to you today about the inequalities, the social inequalities, as it relates to one's chance of growing old with good health. As you know, there's a strong social gradient, whether it relates to the level of education, income, or the socio-professional category. Life expectancy is not the same in the different groups of the population. Lindsay demonstrated some time ago inequalities, strong inequalities, and we can see, for example, that men, so middle managers at 35 years of age, can have a life expectancy of 47 years compared to 41 years of age for manual workers. This gap is quite stark between these two populations. Recent studies demonstrate a gap of 13 years so between the two groups. But these gaps in the mortality are not the only ones that should be noted. There are also inequalities in terms of the chances of growing old in good health. And so manual workers can hope to live less compared to middle managers and executives. But if you look at the hatched part of the graph, they long for longer periods with disabilities. And we can see the same thing for women, even if these gaps are smaller. So shorter lives for women who are manual workers. And this is what we called in a publication which is has been published quite a while ago, but the results are still the same. So this is what we call the double whammy, if you will, of manual workers. So a shorter life and more years of disability. These years of incapacity are lived right throughout life. Obviously, more later on, where there are debilitating illnesses, but there are also effects around retirement age, and we can see inequalities in those number of years of good and bad health. There are already inequalities there, so we can see that there is an inequality in terms of having good health during retirement, but also inequality in terms of your chances of reaching the retirement age in good health, and this leads to questions that are very current today. So social inequalities faced with the years of incapacity, what are they linked to? Well, there is lots of literature about this. If you look at these indicators, we can see that we have been able to demonstrate risky practices such as the excessive consumption of alcohol, tobacco, but also the lack of prevention or food, and we can see factors that correlate with more years of incapacity. So individual factors, but also factors as it relates to living conditions. We were able to demonstrate to what extent economic precarity, so difficult life events, can have an impact on the risks of overcoming diseases and the risk of overcoming incapacity. So there's a strong link between economic precarity, socio-economic factors, and poor health. The final factor, and we mentioned, this has been mentioned in the previous presentation, careers. Careers play a role on health at different levels. So through working conditions, obviously tough working conditions, whether it is due to psychosocial factors or physical factors, the exposure to toxic chemicals, or unsociable working hours that can have an impact on your health, but all other factors, so careers that are made of professional insecurity, they can also have an impact on health and your risk of overcoming incapacity. So these factors do play a role on our health in an individual manner, but they are combined right throughout life. That is to say that the living conditions during your childhood will have an impact during your schooling career, and we saw this earlier on, and the living conditions during your childhood and schooling will also play a role on your health in adulthood. It will have an impact on the career that you want to have, and also it will also have an impact on the protecting practices as it relates to health, your social networks and all the environments that mean you will be exposed or protected when faced with health risks. So your health status will also have an impact on the type of career that you will have with or without breaks, and this will have impact on your environment, your social networks, your professional networks, but also this environment, these practices and these networks will also have an impact on your career, and that career will have an impact on your health. And so at the end of the day, all of this accumulates throughout your career, throughout your life, and this has an impact on your chances of growing old in good health. So once you are aware of these factors and these determining factors, we can see that there are several groups of impacts on health, both in terms of schooling and careers. And we saw earlier on that schooling and diplomas will have a long-term impact on professionals, and then in the working class categories and the middle management categories, and we can see right from the get-go with school and with careers, we can see that there is a risk of exposure to occupational risks, which are different in these different social categories of the population. And so these careers and these will have an impact in terms of resources, the quality of education, and we can see once again in the different categories of the population, different possibilities or probabilities of having more favourable accommodation or more favourable health services. So this has an impact on your chance of having access to healthy food, physical activities, rather than leading a more sedentary lifestyle. And so obviously this all can have defavourable or favourable impacts on health. And obviously this is not all systematically linked, and there are throughout your life chances of protecting yourself from a risk that is probable for your social category. And that is why it is interesting to study the links between health and social background, to see where there is leeway to try to class the difference between careers, living standards, and social background. So beyond the individual characteristics, it should be noted that these health determinants are also very much influenced by environment, and the environment that we can see in models that, such as this one that is being shown on the slide, we can see the influence beyond the individual. So the individual is influenced by their direct environment, their friends, the people in their neighborhood, but they will also be influenced by their living environment, their professional environments, and everything that those environments can bring that are good or bad for your health. And then there's also a wider social and cultural and political, demographic environment that will also shape your way of living your life and a way of protecting your life trajectory. So these health inequalities have become a public health priority. But we can see that there are other policies that traverse all these types of public policies, not just that are not just oriented towards health. So when faced with an inequality in these determinants, we can see here that there is a part that can be avoided. So experts in the field, such as Mackenbach, propose different types of actions that are more or less directly linked to the health of individuals. And so the one that's the furthest away is fighting against social inequalities, generally speaking. So we saw that there are schooling inequalities, inequalities in terms of careers. These are things that have important effects and impacts on your health throughout your life. And policies that fight against poverty or the inequality of access to school or to diplomas, or that to protect against interruptions in careers or exclusions from the working market, these policies will have an impact on health. Similarly, we can also take action on risk factors. So, for example, working conditions. There is the protection of your professional milieu, your living environment to reduce the inequalities in terms of the distribution of these health risks. There are also public health policies with, in terms of the way of making health care accessible. In brief, social and health inequalities are a combination of factors, and that combination of factors require a plural response. So what we should take away is that there are inequalities in terms of longevity. This is avoidable, but nevertheless, these inequalities are not being reduced, and this is a shame when we can see that a great deal of it is avoidable. And why is this the case? Well, we can see that there are risk practices against which we can fight through information. There are different resources, different living conditions that are unequally distributed across the population. So what are the levers that we can use? There are direct levers, so we can reduce the social inequalities, that is to say, reduce the risk of poverty, reduce the risk of inequalities in the schooling system and in more risky careers, in particular in terms of precarity and interruptions in careers. So to protect against occupational risks, environmental risks, and they are also unequally distributed across the social categories. And then also we need to ensure that there is adapted healthcare for people, which is adapted to their living conditions that enable them to obtain treatment. And we need to have a response which has different levels and which takes different forms. So we need to be able to act individually on living conditions and practices, but also we need to be able to have impact at the level of the country as well, and that can be done through policies. And so we talked about the inequalities between social groups, and we observed that there are differences between men and women. Women live longer than men, but longer with incapacities or disabilities. And we can see as well that the professional destiny of men and women is different. So it's quite clear that when we think of social inequalities, we think a lot about the socio-economic groups, but we can apply the same research by looking at the social determinants and the differences between aging and health between men and women. Thank you very much for your attention.